Cataract surgery, July 1996. I say, praise God from whom all blessings flow. Mama had cataract surgery in the 60s, and she had to lay still with sandbags on each side of her head in a dark room for 9 days. Connie and Jane stayed with her. So they too were confined to the darkness. They were not able to read or do any handwork. Mine was absolute the reverse. Technology has improved so much in 30 years. I knew for 6 years that cataracts were beginning. Some grow faster than others. Each ophthalmologist had to tell me that I also had holes in the back of my eyes. Holes are like small hills, but it makes one's reflections differ, which explains why I could not pick splinters out of my children's fingers or cross-stitch. They are inherited. Few people get them. Parents don't necessarily give them to children, so maybe none of you Bud Merle people will have holes. It's how, like, all of you can roll up your tongue and blow. Not me. Again, genes. My ancestors gave me holes, and I can't roll my tongue. The 1996 eye exam. Dr. Boatwright had been checking my eyes for 4 years, watching the cataracts grow and cover the lens of my eyes. I knew before seeing him that time was ready, as every day looked foggy. Car lights came toward me and looked like they had halos around them. TV just wouldn't focus. It always seemed to need adjusting. Joe would try and say, "Mama, you need a new antenna." Threading a needle was next to impossible. Dr. Boatwright said, "Merle, it's time to talk surgery." Well, he assured me how simple the procedure would be, and then he said, "Now, I must tell you, you may go blind. Your body may not accept the implant. You could hemorrhage." And I said, "Not on your life or on my life. An angel will be on your shoulder while you're doing this surgery." Blood work and surgery were set up in Charleston on 2 separate days. 2 separate days, Jane drove me. The surgery was an outpatient type surgery in a clinic. We arrived early and waited. The time came for the prep room. The nurse was friendly, took the history of medicines and allergies. Jane was in the prep room all along. The nurse said, "I'll bring you a warm blanket," and it was warm. I have read since that a warm blanket makes a patient heal faster. The doctor came in and said, "Okay, Merle, let's go." And he added, "You're number 6. We saved the best for last." I asked him, "Are you tired?" He said, "No, I could do 6 more." I said, "If you're tired, we'll take a break until you are more rested." They started the anesthesia. I heard them talking, and I started grunting. Dr. Boatwright said, "Merle, are you hurting?" I grunted back, and they gave me more good pain juice, which meant I must have gone out of it a little bit. As I explained to my doctor, or as explained to me by my doctor, the surgery sounds simple. The eyelid is rolled back. An incision is made smaller than a pencil eraser. The laser breaks up the cloudy film called cataract. Laser vacuums out the cloudy mess. An implant is put in place and stitches are made where necessary. A patch is put on for 24 hours. Doctor said, "Time." Someone told him. He said, 5 more minutes. Finishing on time. We'll have you back to Jane in a minute. By that time, a mask that had been put over most of my face was removed, and we were rolling to recovery. Recovery was getting up to get dressed, drink, go to the bathroom. My appointment was at 11:30 in the morning. We left near 2:30 in the afternoon. Jane and I decided after I was stumbling to stop for a milkshake and be on our way. After picking it up, Jane said, "I'll fix yours when we get away from the window." I said, "I have it." Jane decided my cup lid had braille. Bernie took me back on the following day to have the patch removed, and things looked good. Doctor said I could drive and go to work after 5 days from surgery. 2 weeks later, another checkup, and 4 weeks later, another. A new lens was prescribed, and at first things looked terrible, but now much better. I can thread a needle. I'm glad I had it done. Now my TV is clear, and the fog has left the atmosphere.